Good morning everyone and welcome to the Cabinet meeting. I'm Councillor Amanda Hopgood, Leader of Durham County Council and Chair of this meeting. The meeting is being broadcast live through our YouTube channel, and before we commence with today's formal business, I'd like to cover some of the housekeeping issues for us all to follow. If you could please switch off or make silent your mobile phones and all other devices. Keep microphones switched off at all times unless invited to speak by myself as the Chair. And when invited to speak, please switch on the microphone nearest to you and introduce yourself. So with that, we'll move on with the agenda. Item 1, public questions. We've received no public questions for today's meeting. Item 2 is the minutes. Can I have a mover and a seconder to the minutes of the meeting on the 13th of March, please?
Yes, Chair. Move those minutes.
Thank you. So show the seconder, please.
Second the minutes, Chair.
Thank you. Item 3. Sorry, can we agree the minutes as a true record? Agreed. Thank you. I can confirm for the minutes that they are agreed. Item 3, declarations of interest. Are there any declarations from members this morning, please? No. So we'll move on to item 4, which is the annual review of the Constitution. Can I ask Helen Bradley, Head of Legal and Democratic Services and Monitoring Officer, to present the report, please?
Thank you, Chair. Good morning, everybody. This report presents this year's annual review of the Constitution, which will be approved by Cabinet and/or recommended by Cabinet to Council for approval in May. The approach to the review has followed the same format as in previous years, and as usual, the changes are presented in the order that they appear in the Constitution in the report, and there are tracked change appendices so that you can see the changes proposed, and then at Appendix 15 there is a table that summarises all of the proposed changes in one place. The majority of changes that are proposed are minor in nature and are intended to update or to clarify. And for example, the report sets out there are a number of job titles which need to be updated following changes within the different services. With regard to the articles of the Council, Article 4, which relates to full Council, still refers to local development frameworks, so we're proposing to update those to reference the County Durham Plan. And it's also proposed to include the Council's homelessness strategy within the Council's budget and policy framework, which will mean the homelessness strategy requires approval by full Council. The housing strategy is already part of the framework, and given the close links between the two strategies, it does make sense for them both to be approved by Council. Turning to allocation of responsibilities within Part 3 of the Constitution, under Overview and Scrutiny, the terms of reference for Overview and Scrutiny state that the Chair and Vice Chair of the Corporate Overview and Scrutiny Management Board are additional members of the thematic scrutiny committees. The Chair and Vice Chair of the Corporate Board are indeed members, but they're not additional, so we're proposing to correct that reference. And we're also proposing to update the objectives of the Environment and Sustainable Communities Overview and Scrutiny Committee to reflect that the objectives in the current Council plan have been updated, although I would note that the terms of reference for scrutiny committees generally will be reviewed as part of the work to implement the Local Government Boundary Commission review to ensure that the terms of reference in the areas are correctly aligned. One of the more substantive changes proposed relates to the Audit Committee. Now, the Audit Committee have recently considered and reviewed its effectiveness against the SIT for Best Practice guidance, and that's established that the work programme for the committee is consistent with the best practice guidance, but the exercise did identify that the terms of reference in the Constitution are out of date, and therefore these have been updated to reflect the SIT for guidance, and you can see those set out at Appendix 3. It's also proposed that the Audit Committee will be responsible for the scrutiny of the Council's Treasury management performance, and members of the committee will receive specific training in relation to that responsibility. For statutory licensing, we're proposing a minor amendment just to clarify that the Statutory Licensing Committee comprises 15 members drawn from the membership of the General Licensing and Regulatory Committee rather than a subcommittee of the same. With Joint arrangements, there are some minor amendments to update the membership and functions of the Health and Wellbeing Board. And the review of the Constitution identified that there is no reference to the Council Statutory Community Safety Partnership under joint arrangements. So we are proposing to include details of the Safe Durham Partnership to correct that anomaly. Turning to officer delegations under Part 3C, Table 2, the Chief Executive's delegation, we're proposing to include reference to the Chief Executive's role as Area Returning Officer for the UK Parliamentary General Elections to fully reflect the Association of Electoral Administrators guidance. And you'll note that there is already reference within the Constitution to the Chief Executive's role as Returning Officer for local elections. And then, with effect from the 1st of May, the delegations to the Director of Legal and Democratic Services will move from Table 8 under Resources to the Chief Executive to reflect a realignment of that post and service. Table 3 for Regeneration, Economy and Growth. Again, we are proposing to amend the delegations to reflect the realignment of responsibility for conservation of the built environment from neighbourhoods and climate change to regeneration, as that now sits under the head of planning and housing. And there is reference to the corporate director as having responsibility for all of the statutory duties as local housing authority, but actually it's some, because some of those do actually sit with neighbourhoods, so we're looking to correct that. Should also note that the scheme of delegation includes delegated powers from the North East Combined Authority. The draft constitution for the new mayoral combined authority is being prepared and will be approved on the 7th of May. It's anticipated that the arrangements in relation to transport particularly will be replicated within the revised constitution, but it's likely that as the new combined authority gets up and running, we will likely need to bring through additional changes to the scheme of delegation in future. For the Director of Public Health, there's a minor amendment to remove a duplication. And for Children and Young People Services, again, this looks like quite a significant change, although the heads of service have reviewed the existing scheme and they've requested that the delegations and who they fall to are more explicitly set out. So there's no change in the powers that are delegated, but it's intended to make it much clearer who has responsibility for what functions. For neighbourhoods and climate change, we're proposing to update the list of executive functions to reflect the full scope of the Community Protection Service. And there are currently a number of powers in relation to enforcement, licensing and registration activity, which are listed as requiring the consultation with the Head of Legal and Democratic Services. However, in practice, consultation is only required in relation to certain activities, such as instigating legal proceedings. So we're proposing to include the words "where appropriate" there. And there are some other minor amendments set out at paragraphs 29 to 32 of the report and set out in Appendix 8. Finally, on the scheme of delegations is the Corporate Director of Resources. So he currently has delegated authority to terminate the employment of staff by reason of early retirement, where there is a cost to the Council associated with the early release of pension benefits in consultation with the relevant portfolio holder. We are proposing to amend that slightly to clarify that this delegation also includes the power to terminate employment where there's no cost to the Council. And there's also a proposal to include provision for the charging of appointees policy, which was adopted last year. And then finally, there are some proposed amendments to delegations which are within resources but aligned to the wrong head of service, as well as clarifying the respective roles of the head of pensions and the Director of Legal and Democratic Services in relation to pension appeals. Moving into the rules of procedure, there are some minor amendments to correct numbering errors within the Council procedure rules and the Executive procedure rules. And similarly, with the Finance procedure rules, there are some minor amendments to update legislation references, the role of the Audit Committee with regard to that scrutiny of Treasury management performance, but there is also a significant update to Appendix A so that they fully reflect the financial management standards, and you can see those at Appendix 12. In terms of the Code of Practice for members and officers dealing with planning matters, that's been reviewed following the publication of Lawyers in Local Government's Code of Good Practice with regard to planning matters, and a number of changes have been proposed to ensure that our arrangements reflect best practice. Those proposals, as set out, have been considered by the Constitution Working Group on the 22nd of February and the 19th of March, and the Constitution Working Group was supportive of the proposals. There is a further proposal to be presented to Constitution Working Group in advance of the annual council meeting in relation to the terms of reference for the Chief Officer Appointments Committee. We are going to ask that the terms of reference are amended to make it clear that the chair and vice chair of that committee will always be the leader and deputy leader of the council, which will essentially formalise what has been the practice since that committee was formed. That is something for council to approve, so if Constitution Working Group are supportive of that proposal, that will come forward in the report that is presented to full council in May. Chair, the recommendations are at paragraph 4 for the approval of the delegation of executive powers and amendments to the scheme of officer delegations, actually set out at paragraphs 22 to 43 of the report, not 20 and 40 as set out in the recommendation, and recommend that council agree the proposed revisions to the Constitution at the annual meeting on the 22nd of May.
Thanks, Helen. The Council's Constitution sets out how the Council operates, how decisions are made and the procedures which are followed to ensure that these are efficient, transparent and accountable to local people. Some of these processes are required by law, while others are a matter for the Council to choose. It is good practice to review the Constitution regularly and to ensure that it remains fit for purpose and reflects good practice and legislation. The report summarises the work that has been done throughout the year in reviewing all aspects of the Constitution. The majority of the proposed changes are minor in nature and are intended to update provisions to reflect changes in staffing arrangements, legislation, to clarify and correct inaccuracies. The proposed changes to the officer scheme of delegation in respect of executive functions are minimal, but essential to ensuring that council business can be conducted efficiently and effectively. The proposed changes to terms of reference and rules of procedure and code of practice for members and officers dealing with planning matters fall to council to determine. However, the proposals will ensure that the council's governance arrangements are fit for purpose and reflect best practice. As in previous years, Constitution Working Group have been consulted on the proposed changes and were supportive of them. It is beneficial to have cross-party input to this process. In moving the recommendations set out at paragraph 4 in the report, I'd like to take this opportunity to thank the Monitoring Officer and her team for undertaking this year's review, and to all the officers across the Council who have contributed. Can I invite Councillor Richard Bell, Deputy Leader and Cabinet Portfolio Holder for Finance, to second the report, please?
Thank you, Chair. I echo your comments in relation to the importance of keeping the Constitution under review, and therefore I am happy to second the recommendations.
Richard, is there anyone else wishing to speak on the report? In that case, can we agree the report and its recommendations, please? Okay. I can confirm that the recommendations are agreed. Item 5, Health Protection Assurance Annual Report. Can I ask Amanda Healy, the Director of Public Health, to present the report, please?
Thank you, Chair, and good morning, everyone. In terms of this report, this is an annual report to give assurance in relation to our health protection arrangements. What we have this year is quite a short front report and then a longer report which can then be shared with partners, because health protection is very much a multi-agency responsibility, and we need assurance that partners are carrying out their health protection duties. So I'm going to run through the main report and then I'll come back to the recommendations. Obviously, health protection is one of the statutory responsibilities of Director of Public Health, often discharged through others and obviously by close working with our communities. And I guess the report from probably page 6 to 12 sets out a wide range of arrangements and the governance that we have in place locally, working very closely with different organisations, particularly when it comes to health protection, the UK Health Security Agency, but also obviously colleagues across the council and local partner agencies as well. And there's a lot of interdependencies and close working arrangements that have to be in place to ensure that health protection arrangements are robust. Obviously, health protection arrangements does affect health inequalities as well, and I think what we've started to see in post-COVID world of health protection is the emergence of some diseases that had been previously eradicated, and some that have, disproportionate effect on our residents from more deprived communities or possibly our prison population or migrant and asylum seeking population, and that changes how we work in relation to health protection. We do have a Health Protection Assurance and Development Group, and that's multi-agency and oversees the links to partner organisations, including our local health trust, our school-based immunisation provider, UK Health Security Agency, etc. And I think in the last year we've also been, I'm not sure as fortunate, but I was the lead for health protection from the Association of Directors of Public Health. And you'll see in the report, this gave us input to some national work, particularly around vaccination, which was quite important given the rates of and the work on measles, mumps and rubella. From page 12 onwards, I outlined the screening and where screening achievements and rates are for our local residents. Screening is an NHS England responsibility. And I think what we can see in the report that for several of our screening programmes, they've definitely recovered since COVID. So we see a higher than national average uptake of screening for our bowel, cervical and diabetic eye screening programmes, which is really positive, and AAA is similar to the national average. However, what we see for breast screening is that it has dipped below 70%, which is the national standard, even though this is higher than England, which is only at 66%. So we are working with NHS England colleagues, and some questions have been raised through scrutiny in relation to breast screening and access to breast screening for our local women. We see from page 16 to 22 our local immunisation vaccination rates, and I think it needs to recognise that vaccination is one of the major public health interventions to prevent disease. Again, this is an NHS England role with input and delivery from partners, including particularly our primary care colleagues and our local trust. Thankfully, our childhood vaccinations are exceptionally high, with all vaccinations over 95%, and there's 14 childhood vaccination programmes. The only one that is dipped below 95% is measles, mumps and rubella second dose, which is obviously a bit of a concern for us, given the national incident in terms of measles and outbreaks in other parts of the country and in the North East. We have, you'll see in the report, carried out a dedicated rapid assurance exercise, locally looking at uptake through our GPs, and a series of recommendations working with some of our particular communities, our Gypsy Roma traveller communities, asylum-seeking communities, the production of materials, communication, engagement with those groups, and also a real push for NHS staff to ensure that they're vaccinated. Adolescent vaccinations is more of a concern, and I think it's an area that requires further assurance. We've seen a change in our provider for childhood, so adolescent vaccinations, and we're certainly seeing, although it is now increasing, so for HPV vaccination, which is given during school years, and which can prevent not just cervical cancer, but a range of cancers affecting boys as well as girls, that is lower than the national average. So it is an area of real focus for us. And that was also the case for flu vaccination. For our adults, however, we see our over 65 flu higher than national average. Our care home vaccination rate for flu is very, very high, and that's very much about close work with our commissioning team and our local community services delivering into our care homes. And we've also seen a high uptake in our staff flu offer, with on-site offers being taken up really well by staff. The report this year has also got some case studies to try and bring kind of health protection to life a little bit. It can be a bit of a dry subject, and you'll see a really nice case study from Horden Nursery where staff have delivered vaccinations on site, making it much more easy for parents to access vaccination. And there was a good uptake of flu vaccination for the 2- and 3-year-olds in Horden Nursery. The report then goes on to our communicable disease and outbreak management arrangements on page 22 to 30. And this is where we do work really closely both with UK Health Security Agency and working very closely with our Community Protection Service locally. And I guess the range of infectious diseases have come back to the fore. So we are seeing, you know, TB, we've seen quite a lot of scabies, we've seen Group A Streptococcus. One area that we really do want to focus on in the coming year is we're starting to see an uptick in some of our sexually transmitted infections, even though we're still lower than the national average. And there's a really 2 good case studies there, some excellent work with Durham University, an emergency exercise looking at cases around meningitis, and the development of our local health and wellbeing strategy, which has been overseen through the Health and Wellbeing Board. We then go on to environmental hazards from page 30 to 35, and I think this year we've seen some really good, much more closer working arrangements with our colleagues across the Council and beyond in relation to climate change and the impact of climate change on human health, and of course vice versa. So work on air quality and ongoing good work with our Community Protection Service, both in terms of their staffing in relation to health protection, food safety, outbreak management, etc. And I think this will be an area that will grow in future years as well. And then finally, ensuring that we are prepared for emergencies, and obviously very close working with our Civil Contingencies Unit locally, a range of exercises over the course of the year, and some really joint work with colleagues in the NHS and the Council and the voluntary sector on winter planning and resilience, moving into winter and during winter, and in relation to adverse weather, which I'm sure again will continue into the future. You'll see in the front of the report there's some kind of key achievements, and that's reflected in the exec summary in the full report, and some areas for focus which I've outlined as I've gone through the report, particularly our work around sexual health, continue to work with the new provider for our school-based immunisation programme, and to really maximise the uptake of measles in terms of uptake of vaccination and readiness to respond to any outbreak. And so, Chair, the recommendations for the report are in paragraph 6, and they're to note the report that it does provide broad assurance. It's very challenging to have full assurance, but it also outlines some of the particular areas for improvement that will form an action plan for the coming year, and close working arrangements with those key leads and partners for that work. Thank you, Chair.
Thanks, Amanda. I invite Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to speak to the report, please.
Thank you, Chair. Health protection is a statutory function of the local authority. Within the Health Protection Assurance Annual Report 2023-24, the Director of Public Health provides detail to Cabinet of the adequacy of prevention, surveillance, planning and response to reduce the harm from health protection issues that affect County Durham residents. The report also identifies areas of concern and risk, mitigations to date, and where further development and assurance is required in the coming year. The report clearly demonstrates the strength of the partnership relationships across the system, including the UK Health Security Agency and NHS England, as well as DCC colleagues, including environmental health officers and the Civil Contingencies Unit and local healthcare, GPs, ICB, PLACE and the Foundation Trust. I'm pleased that the report highlights key developments this year, including the MMR Rapid Review, the publication of the County Durham Sexual Health Strategy and the significant work across partners to promote winter preparedness for services and winter wellness for residents, including the evolution of the Warm Spaces network to Welcome Spaces. I note the concerns highlighted regarding the performance of the school-aged immunisation service and the sexual health services, and welcome the recommended actions to address these to improve health outcomes for the residents of County Durham. And I thank Amanda and her team, and I am happy to propose the report. Thank you, Chair.
Thanks, Chris. Is anyone else wishes to speak to the report? Ted?
Thank you, Chair. I'd like to speak to this report because the protection of the health of our residents is of the utmost importance and is wide-ranging, as we can see in this report. I am pleased to acknowledge the broad assurances that effective processes are in place with each of the key elements of health protection. I note the sustained delivery and performance in the county, particularly the 0 to 5 childhood immunisation programme, which exceeds the national standard, and the averages and the significant effort to increase the national standard, to increase the MMR second dose uptake, especially in light of the current context of the measles outbreak in other parts of the country. I also note the successful planning and delivery of the targeted 2 to 3 year flu pilot programme highlighted in the report, and commend this innovative practice and the achievements of the highest uptake for this age group across the North East and North Cumbria integrated care system. I look forward to further discussions on the key health protection issue at the Health and Wellbeing Board in May. Thank you, Chair.
Thanks, Ted. If I can just add a quick thanks as well. I think this report highlights the very best of things that we do in County Durham, especially with the case studies and how we work in partnership and how that is a key to the success of what we do. And I'd also personally like to thank you for the glossary at the end, because that makes for interesting reading, and I'm just pleased we can use the abbreviations rather than the full words when we're reading the report. So thank you, Amanda, for that. Is there anyone else wishing to speak to the report? Okay, can I ask Cabinet to note the report, please? Thank you. Item 6, Durham County Council becoming signatories to the Mind Mental Health at Work commitment. Can I ask Amanda Healy, Director of Public Health, to present this report, please?
Thank you, Chair. And I'm presenting the report, and Alison Lazazara is here as well, because this is very much joint working, both across the council and obviously with our partners. And the report this morning is to put forward to Cabinet an overview of our ongoing work in relation to how we want to seek to improve mental health and well-being, an overview of the Mind Mental Health at Work commitment, and then propose that we become a signatory to the commitment and encourage other organisations to do so too. I think we're all aware that good mental health is fundamental to functioning well and to everyone's health and well-being, and that work is also a key influence on health. There's really strong evidence that being in good work has a really positive impact on people's health and well-being. Conversely, being in poor quality work can have a negative impact. And I think in County Durham we have really ensured that mental health is a priority, both as a council, but it is also one of our 4 priorities for the joint local health and wellbeing strategy, and has been identified through our joint strategic needs and assets assessment as one of the biggest contributors to people's health and wellbeing in County Durham. You can see in the report why it is a real priority for us in terms of some of our stats locally, which is why we do want to focus on this. And also, I think, in terms of discrimination, that we want people to be able to talk about mental health openly. So we know that in relation to depression, we have a higher percentage of people in County Durham who are diagnosed with depression. We've also seen an increase, particularly post-COVID, in terms of the percentage of school children who have emotional and mental health needs. And in spite of a huge amount of work, we still see our suicide rates higher than the national average. So I think this is why the focus on mental health is so important, and we do see that, and there's an outline in the paper of the kind of key elements of our joint local health and wellbeing strategy. Councillor Hood chairs the Health and Wellbeing Board, and there's the members of Cabinet on the board. And that strategy covers kind of key areas in terms of children and young people, suicide prevention, robust responses to urgent and emergency mental health care, having a consistent dementia strategy, really working with our communities in terms of being resilient and promoting good mental health, and new models of care for adults with serious mental illness. So again, very much working in partnership with others. And the report gives some examples of that work from the strategy, including our health and wellbeing framework for schools, which is a universal approach to support health and wellbeing across all of our schools, and then some more targeted work, for example, within our particularly some of our larger County Durham organisations to sign up to this commitment. So the recommendations in this report are in paragraph 14, and it's to note the contents of the report, to agree that Durham County Council becomes a signatory to the Mind Mental Health at Work commitment, and to encourage other organisations to become signatories to the commitment too. Thank you, Chair.
Thanks, Amanda. Can I invite Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to move the report, please?
Thank you, Chair. Improving mental health, resilience and wellbeing is one of the 4 priorities of the current Health and Wellbeing Board Joint Local Health and Wellbeing Strategy. Good mental health is crucial to good overall health and wellbeing, and poor mental health not only impacts on the person, but can also impact upon families, friends, relationships and wider society. Durham County Council recognise the importance of good workforce mental health and wellbeing. In 2018, it became a signatory to the Time to Change Employer Pledge, which supported us to create a more open and understanding culture around mental health, as well as helping us to tackle associated stigma. As an organisation, we celebrate positive mental health by supporting annual campaigns, including Time to Talk Day, Mental Health Awareness Week and World Mental Health Day. These campaigns give us the opportunity to bring staff together to focus on benefits of good mental health, tackling stigma and helping us to understand and prioritise our own and others' mental wellbeing. As a result of the closure of the Time to Change charity, we now look to the Mind Mental Health at Work commitment as a structured approach to support our work to continually develop and improve our approaches to making DCC a healthy and happy place to work. The Mental Health at Work commitment is a national movement comprising a set of 6 standards and supporting actions that will help us support the mental health of our people. It will help us prioritise workplace mental health, develop an organisational culture to drive positive mental health outcomes, increase our confidence in dealing with such issues, and promote an open culture around mental health itself. This last point is really important, as stigma still prevents people having open conversations about their own mental health and well-being. The commitment will also give us access to a wealth of resources that will help us to improve our approaches to workplace well-being, and will complement existing provision such as our thriving Better Health at Work programme, our Employee Assistance programme, our Wellbeing Portal, and our well-established networks of mental health first aiders, health advocates and anti-mental health stigma ambassadors. By becoming a signatory to the commitment, DCC will be making a public commitment to improving employee mental health. We will be joining a steadily increasing list of local and national organisations who have also made such a commitment, and we hope to motivate other local workplaces to follow suit. If this proposal is supported, we will celebrate becoming a signatory to the commitment during Mental Health Awareness Week, which is taking place from the 13th to the 19th of May, when a series of events will take place to bring people together and raise mental health awareness across County Durham. I have no doubt about the benefits that the Mental Health at Work commitment will bring for the whole DCC workforce, and I would look forward to seeing this movement grow across other public, voluntary and private sector workplaces. Thank you to Amanda and Alison and everyone involved, and I therefore recommend that Cabinet agrees to this proposal. Thank you, Chair.
Thanks, Chris. Can I invite Councillor Richard Bell, Deputy Leader, to second the report, please?
Thanks, Chair. As a council, we're well aware of the impact of poor mental health on people and on their work. It can affect their confidence, morale, general well-being and lead to absence from work. As a signatory to the former Time to Change Employer Pledge, I'm pleased to see that we are now seeking to progress this good work by becoming a signatory to the Mind Mental Health at Work commitment. This will only add to the support we provide, ensuring that we put in place key actions that will help us to achieve better mental health outcomes. As a member of our Health and Wellbeing Board, I know that mental health is a key public health priority. Signing this commitment will not only benefit our staff, but it will send us a clear message to the wider community that mental health is a priority for the Council. Accordingly, I'm happy to second this proposal and the recommendations at paragraph 14.
Thanks, Richard. Is there anyone else wishing to speak to the report this morning? Okay, in that case, can we agree the report and its recommendations, please? Agreed. Okay, I can confirm that the recommendations are agreed. Item 7 is any other business. I've not been notified of any other business. So I'd like to thank everyone for taking part this morning, and to those members of the public and media who have watched the meetings. I'd also like to apologise for anyone watching for the communication issues that we had with the microphones during the meeting. That concludes the business for today.